back to another Thrive Live. Today, or again, we have Dr. Meg Holpuch. Thank you again for coming because I forgot to hit record last week, so she is graciously re-recording this week. So thank you very much for coming on. Dr. Meg is one of our naturopathic doctors at the Naturopathic Wellness Center. She is on the board of Pediatric Association of Naturopathic Physicians. Dr. Meg aims to identify and treat the cause of illness by using naturopathic dietary and lifestyle approaches to get you from sickness to wellness. Dr. Meg's specialties focus on pediatric and family medicine, as well as chronic issues like Lyme disease, mold, and autoimmunity. And Dr. Meg actually runs our Thrive Pediatrics program in our office. So thank you, Dr. Meg, for coming and talking with us today. And so excited to get into our topic.
Thanks for having me again, Dr. Jenny. This is a lot of interest and a hot topic in the medical field, mostly because we're still learning a lot about it and we're starting to diagnose it a lot more often, which is autism.
Yep. Let me know if I get a little choppy and I'll go inside. You just got a little choppy there. Probably was on my end. So, okay. All right. So let's first define what is autism.
Yeah, so autism, a lot of people just, such an old term, like, is really not a term we want to use anymore, and it's really doesn't define autism. Broad spectrum for neurodiversity. So neurodiversity, I want to define this because it is a bigger term. It's a key, and people don't understand what it is. So it describes people in a world around them in many different ways. One really is no learning or behavior. These differences are not supposed to be viewed as deficits. A lot of cultures actually take this as a blessing or a gift in many different cultures. So it really is not a deficit. It's just these people that relate with the autism spectrum they just relate to our world differently. And that is a beautiful thing. Harvard has a really good insight about neurodiversity, but autism is very common right now. Diagnostically, we get 1 in 54 children in the United States are identified with autism spectrum disorder, but this is likely higher due to the bias. And we do notice that every year this does increase. Jenny, can you hear me okay?
Yeah, you were just kind of chopping, and I don't know if it was my internet or if it's yours.
I think it's probably my headphones. Let me pop off my headphones and we'll talk. Okay. That's probably what it is. Can you hear me better now?
Oh, much better. Yeah.
Okay. Great.
All right. Earbuds were dying.
Earbuds are dying. Well, they're not dying. I don't know what the issue is. Maybe they have a lifespan just like every other thing they make Apple product wise. All right. Yeah. So, with that diagnosis, it is, there's 100%, with 100% certainty, you have probably had a family member or a friend or someone in your community that you interact with that actually has some degree or that's on the autism spectrum that you're probably likely aware of or not aware of. A lot of times some people who do fall on the autism spectrum, their symptoms are a bit mild and they have really good, those tools and coping mechanisms to work around that. So a lot of times you won't even know some people have autism.
Yeah. And I might have missed it just because I was trying to figure out what was going on with the audio, but did you talk yet about how autism is on the spectrum of neurodiversity and what neurodiversity is?
Yes. So then neurodiversity is that idea that we just experience and interact with the world in different ways, like thinking, learning, behaving, both with our tactile environment, our spiritual environment, as well as our communication with other people. Mm-hmm.
And then what are some other diagnoses that fall into that neurodiversity spectrum?
Oh gosh. You name it, Jenny, it's all over. It can be anything that goes into more specifics of like, say, sensory processing. Sensory processing disorder is one thing, but sometimes it's a kind of offshoot from autism spectrum disorder. And that's where going and seeing a a licensed therapist can help differentiate the differences in that neurodiversity platform. It can come down to sensory, come down to pretty much any of the senses, right? Texture, taste, temperature, as well as auditory, as well as ocular. I actually just had a patient diagnosed with Eileen syndrome. Child is not autistic, but literally cannot process what he is seeing because of the way it is seen. So anyways, I mean, that's another area of neurodiversity, though not technically autism, right?
Yep. Yeah. And same thing with dyslexia. There's a lot of other things that fall into that bucket that
right.
Not just autism.
Correct. Oh, and it's not autistic, but neurodiversity. We've got OCD, ADD, ADHD, right?
Yep. All of that.
Yep. Perfect.
So let's go ahead.
No, go ahead.
All right. So I guess probably good segue into, let's talk about the taboo around autism.
Mm-hmm. Yeah, absolutely. So I like to talk about, it's just that people have a hard time talking about autism, especially if you don't have an immediate family member with it, because we get really uncomfortable interacting with these people. Autism, there again, is not supposed to be looked at as a deficit. Many people with autism should be celebrated for their uniqueness and that neurodiversity. They bring in an element of new ideas and views. They relate to life a lot differently than others. And this can be, and usually is, a beautiful thing. A lot of people who are on the spectrum are ones that are inventing and creating and exploring new medium, new technology, engineering. I mean, we have groundbreaking results in a lot of areas due to people who just know how to think differently or outside of what we consider different, right? What is normal? I like to bring that up too. Like, it's not that there's a big, like, there again, it's just diversity. It's all beautiful. It's just like gender. It's not black or white. We have a spectrum. So we're scared of what we don't know. So let's get comfortable with it, because it's likely, like I said, you either know someone or you'll come across somebody with autism or on the spectrum or identifies with it. And sometimes, it's really great to know what's appropriate, what's not.
Yep. So considering a lot of some people may feel like they are, uncomfortable around an autistic person, what would be some good ways that we can interact?
So I actually follow somebody on Instagram, and unfortunately I can't remember their Instagram page this moment, but they talk about, what's appropriate, what's not in those social settings. The best things to do is to never just come out and say, wow, you're, so when because I do mostly pediatrics and autism, it's mostly like if your child is interacting with another child who is autistic, you don't want to go, if your child, let's say this, like, say for instance, I have a 6-year-old son. He'll come up to me and go, that child looks funny. And I go, you know what, Oliver, it's not that they look funny. It's that they are different and they are beautiful in their own special way. They might talk a little differently than you. They might speak, they might listen a little differently. They might interact with you differently, but you know what? They think you are different too. And that's wonderful. And, when you put it on on that level of normality, then it's like, oh, okay. So really, and like I said, the best thing is just to talk. Also, if you're questioned about it, like, ask the parent, like, what's a safe way my child can play or interact with your child? Or say, is it okay if my child plays with your child? And they'll absolutely inform you, yes or no, or just be like, oh, he's deaf in one ear, so just talk on this side or whatever. Parents are always, they're always lovely and wonderful. You just never want to say, wow, your child looks odd or looks off, or never come out and say, is your child autistic or whatever. It's a powerful assumption, right? While it might be obvious, it's not ideal to come about it that way.
Yep. Perfect. So let's dig into the causes. What causes autism?
Gosh, good question. Loaded question. And it's a lot more complex than having a simple, I don't really have a simple answer, but I will talk about it. Well, or always finding out more each day, each month. There's so much research going on in this area. But first and foremost, most of the time we find this diagnosis, it's usually due to a genetic variation, whether it's a deletion or insertion on a SNP, a single nucleotide polymorphism. Did I say that right? Yeah.
Yep.
SNP.
Yep.
Thanks. So there's so many genes. I mean, there's still genes that we're still exploring that we still don't know that contribute to autism spectrum. So, we still don't know the full implication of it. There's usually when there's more variation, there's more severity in the syndrome, but that's not always the case in ASD. Toxic elements are a big one, either exposure while the baby's in the womb or after birth that alter the neurological phenotypes, right? Physical traumas in the womb or after birth, such as a traumatic brain injury, alters the brain functionality and the chemistry, can, create some of those changes short-term, long-term, or maybe permanently. One area that I think is really important to address, and an area that I always support for children, is a leading idea in chronic inflammation to the nervous system. So what this is like over time, whether it be a genetic variation or a toxic element or a trauma, there is some sort of, neurological changes, and inflammation can be a big piece of that puzzle sometimes. So always supporting that nervous system, with antioxidants, or supporting with those amino acids that might be less produced in that child's body. So this inflammation usually starts from some assault, that alters the genetics or brain chemistry. So some, examples would be like a bacteria or virus, the physical trauma, obviously a toxicant. The other thing to mention is environmental toxins. Sometimes we find that tendencies we see in autism actually can sometimes be caused by an environmental exposure that's too high, or heavy metal like lead, big one to talk about. Sometimes we don't know, and there's still a lot we don't know. So that's kind of where we are right now.
Yep. Well, it's like, almost, anything in medicine these days, most of the time, at least what, I find clinically, is, health is a orchestra, just like how you're explaining how autism is this orchestra of events. You can't just say it's just this one thing. It's really this, like you were saying, it's this whole orchestra of things that go on, of how the biochemistry is speaking, of the toxicants. Maybe there was a virus that kind of kicked the imbalance off.
And that's a really good point too, because, while autism, ASD can start with a genetic variation, there are also those compounding factors that are so important to explore and to remove those layers to make sure that, the patient's individual body is able to thrive and grow and continue to develop as best it can. Like I have quite a few patients in my practice that it's like, okay, we can't obviously straight up change what we're born with, but we can absolutely do everything in our power to support that child's body dietarily, lifestyle wise, supplementally, testing, all that jazz, to really make sure that they grow and develop as best they can. That's why getting the diagnosis, which we'll talk about here in a sec, getting the diagnosis and getting that treatment early on is so, so critical.
Yeah, we're wanting to make the approach about optimizing their health.
Correct.
Yeah, not about curing.
Correct. There's no curing, but there are so many different aspects that you can look into and investigate and improve on to just make everyday struggles become no longer struggles, right? So yeah, for sure. So diagnosing it, if you suspect your child or somebody that has autism, it just depends. So I do pediatrics, and in my practice, we do the MCHAT questionnaire. These are for like mostly kids in the toddler years. Once they get older, there's a different questionnaire. And it starts there. Pediatricians will give us the parents and they'll answer these questions. I think it's about 20 to 30 questions, and then it's graded. Once it's been graded, then if the pediatrician deems that it needs further workup, they'll send you to a specialist. So the specialist that can do the more intensive, laborious, like assessment and official diagnosis are your developmental behavioral pediatricians. So these are pediatricians trained in developmental behavioral health, child psychologists or child psychiatrists, and then pediatric neurologists. There again, it's an MD pediatrician with neurology specialty. So it's hard sometimes. A lot of these specialists are in demand, and it can take months and months to get in to see them. But a lot of times once that diagnosis is made, those therapies and interventions are set in place, and you can get going sooner rather than later.
Yeah, and having an early intervention is just so important.
It is. And it makes it so much easier for the whole family unit involved, because then everyone, hopefully from an earlier start, is on the same page as far as working through all of the new challenges and all of the new tools to put in place to create a healthy, safe environment for that child.
Yeah.
Yeah.
So let's kind of compare, like, what does conventional medicine have to offer? What do we have to offer as naturopathic doctors?
Yeah.
How do we blend all of that together?
I know, right? It is. And it truly is that. It is putting it all together for these families. So you're a pediatrician, they'll send you off for the official testing and workup and tests. Once that official diagnosis is made, usually that person will send you back to your pediatrician, or they will also start you on that process of what kind of therapists need to be put on place. So like occupational therapists that do, if your child has more struggles with speech, either speaking or processing, eating, play therapy, sensory tactile therapy, PT for physical therapy as well. Also it'd be great, they also do therapists for mental health support for both the child and the family. Sometimes if you're lucky, they might refer you to a dietitian or nutritionist if, optimizing the diet is important. I don't always see that. And that's a big missing piece of the puzzle, in my opinion, when it comes to conventional medical providers referring out for all these things, because I personally truly believe that you need to have good food going in to get good results of like what's coming out, right? Food is medicine.
Food is medicine. You can't out supplement a poor diet. Food is medicine.
Nope. So true. Yeah, well, and that leads us into like the big areas that a lot of families come to me for, and that I support, is the dietary aspect, like working with the picky eating or the disordered eating. I am not an occupational therapist by any means, but there are a lot of times some areas that we can find that are tips or tricks to really work around some of those picky areas. So like children with ASD need additional support, whether it's taste, texture, temperature. So making sure we get all those nutrients in some form or fashion, and if anything's missing, what can we do to make up for that? So we can and do support the downstream effects of those genetic variations a lot of times by making sure we're optimizing that diet. So whether we know the variations, we can and do that. So the biggest areas are those healthy fats, the proteins, and the amino acids for the brain. The other area I think is really super duper important is the blood sugar regulation, as well as the food, the fluids, the water. Huge. Water is essential for life, right? But with blood sugar, a lot of times a lot of children who do identify in the more severe aspect of the autism spectrum don't know how to communicate, like, I feel exhausted, or I feel really tired, or I have a racing heart. A lot of times they just have emotional outbursts, right? And sometimes that can come down to their blood sugar. Huge aspect there. So really having parents super informed on what blood sugar is, what raises it, what lowers it, what keeps it more steady is so pivotal.
So pivotal. I mean, if you just look at any kid, blood sugar is so crucial. I mean, you see what happens when not even just like Halloween candy and a lot, candy, but from the aspect of, are they getting a good protein? Are they getting a good fat? Are they getting a good breakfast in the morning before they go off to school? Because, you'll see the effects at 3 o'clock when you pick them up.
Oh, absolutely. Absolutely. I mean, the thing is like children have such a fast metabolism. I mean, they're growing exponentially. And so the blood sugar regulation in children is far more variable than it is in adults. I mean, we also are very attuned. The other thing is we have that, that subconscious innate kind of, hopefully, reaction to be like, oh, I need to eat something. I'm hungry. That's where, your body chemistry is telling you things and you know how to go and do that, right? A lot of children who don't know how to communicate in some form or fashion, or, are on the autism spectrum, don't have sometimes the capacity to recognize what that need is. And so it usually ends up with a big disruption in some form or fashion.
Yep. Yep. And you'll see it in adults all the time too. It's just that we may not be as visual or vocal about it.
Well, and I still say this about adults and children too. It's like if a child's asking for a sweet or a sugar, or if an adult is craving it, go to water first. Always go. It's actually sometimes it's usually you need water and not sugar.
Yep. And look back at the earlier in the day. How was the diet? How was your stress? Did you get enough sleep? All these things will affect not just the listeners, adults' blood sugars. I mean, it affects everyone's, but you'll really see it in the kids too.
Truly. Yeah. And, the other thing about, those big emotions is also the sleep, right? Mm-hmm. Without good sleep, our mood and behavior alters drastically. So another big area I work with families is the sleep hygiene aspect, right? Some children, are very particular about how their sleep or their environment. And so really working with that is critical, because without that sleep, our brain can't rest, our body can't rest, right? We do a lot of regeneration at night. And if we aren't able to get into a good circadian rhythm and getting into REM and out of REM appropriately, everything else kind of falls short, right?
Yep. Well, let's take a hot second here and talk about what is good sleep hygiene. Like, what would you recommend for kids?
Yeah, that is a great question. I think the biggest thing is making sure that they're not getting overheated or too cold at night. So temperature regulation and night lights. Like I'm still even working with this with my 7-year-old. He likes to sleep with his lamp on. And I'm like, oh gosh, it's got to be messing with your circadian rhythm. But you need to have it as dark as possible, as tolerable for the child. So they can get that good sleep, because with that extra light stimulation, like I said, circadian rhythms get way off. So the temperature, the lighting, and then, so their pajamas, that's a big thing too. A lot of kids have these like thermal pajamas or pajamas that are made with all these chemicals in them. It can be a thing. And then also the sheets, right? Breathable sheets, big aspects. What else am I missing, Dr. Jenny? I know when we did this last time, we had a good side note here, and I was like, what was it?
I know, we had so many. Technology, I think it's an important one to bring up. Tablets, Minecraft, that's currently a huge hit in my family, and I made my whole family just so like everyone, like controllers down, we're doing 5-minute walk outside down the street.
Well, I love doing, after dinner outside time. I know a lot of families, it just depends on when your dinner is and if that's feasible, but we like to try and do dinner a little earlier. So we have 30 minutes of just outside time, whatever, in any capacity that is. It's re-regulating too, because when you're outside, also you're getting that natural light. And we as humans are supposed to be sleeping during the dark, and we're awake during the light, right? And right now we've got a lot of shifting and there's more light, but truly, like when we have that regulation with our earth and our planet, sleep gets so much better. So it's also like re-regulating those eyes and what's coming in. Gosh, we had another thing. What was it? Anyway, maybe it'll come back to us.
We had temperature, texture, environment,
Tablets, yeah. So no screens before. Sound.
Our technology, fast sound.
Yeah, you can do, sound machines are sometimes helpful, just depends on the child. I find sound machines or like meditations not as helpful with children on the autism spectrum, but there again, every child is unique and different, and what works for you may not work for the next person. So
I'll come back to me, but I was just trying to think if we're missing anything there, because I feel like this is such a critical step for them, because they really need that sleep.
Mm-hmm. Yeah. And then as far as like timing recommendation, just depends on how old the child is, but as much sleep as they can get. I love it when children naturally wake up on their own and not to an alarm. That lets us know that they got the hopefully appropriate amount of sleep, right? When they're waking up on their own versus us going in and waking them up. If you're finding that you have to go in and wake your child up every morning, you need to bump back that going to bedtime.
Yep. Do you see, in general, just at least in your pediatric population, any like higher percentages of sleep dysregulation in your autistic patients versus non-autistic patients?
Yes, absolutely. I find in my practice that children that identify on the autism spectrum, that usually there's a huge deficit. A lot of them don't get enough sleep. And sometimes we try and bump that up. When we can't, that's where we really talk about that quiet time or alone time. So their brain isn't overstimulated. It's so much about that stimulation, right? What is too much, what is not enough, and what's that appropriate, bell curve for them. So when there isn't, we try and optimize sleep as much as we can. If the child, say optimize like for their age is like 10 hours per night, if we're only getting 8, where in our day can we allow for 2 hours of quiet time to allow them to have that mind rest? So yes, a lot of them don't get near as much as I would hope, but we work on it and we support as much as we can.
And it's kind of similar vein. I was thinking about stimulating sleep. How about we stimulate their cells? Kind of just dig into the cellular functions that you find that we need to support in autism.
Yes. So a lot of things have to do with like the mitochondrial function, right? The biggest aspect I think that I kind of start with for a lot of people are those B vitamins, which are a lot of our cofactors for a lot of our neurotransmitters, epinephrine, norepinephrine, dopamine, serotonin, a lot of them, different Bs, as well as amino acids, like our simple basic amino acids, huge for all of these complex, cycles in our body. Another aspect that is really interesting is methylation. I generally really like to test the methylation cycle. If it hasn't been tested in a child that identifies with autism, and working with that methylation. So now with that being said, you really have to be careful with methylated folate and methylcobalamin, which is a B12 vitamin. So you gotta, I think it's important to have talk to somebody who knows what they're doing with methylation and B vitamins. Because not every B vitamin will be tolerated appropriately by everybody. Antioxidants, huge, especially for that neurological support. You can do it both with food and supplementally, because it reduces that risk of that free radical damage in the neurological system, brain, and the whole nervous system down the vagus nerve. And so sometimes we'll do like herbal nervines, which are just like herbal therapies to help regulate that nervous system, or at least calm it. Because a lot of times when children on the spectrum, we have a hard time with switching back and forth between norepinephrine and epinephrine, and sometimes they get stuck in one way or another, and we want to modulate that as best we can.
There's so much that we can do, not just lifestyle, but also just modulating the genetic pathways.
Truly. Another aspect is the healthy fats, the brain, the omegas, huge, 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 huge for this population.
Interesting. What about, let's dig into mental health.
Yeah. So mental health, I almost sometimes won't work with families if they don't have a mental health therapist or counselor on board, because as children get older, they become a lot more, believe it or not, like I said, don't think that if someone's autistic that they don't understand you, they don't understand their environment. No, they fully understand you, they understand their environment, they just relate differently, right? The suicide risk is 8 times higher for those that are diagnosed with ASD, to the lack of acceptance and the isolation that they experience. So as a child gets older, or even adult, having a mental health therapist who works with people in this population is absolutely critical. And also that the parents are supported. So if you have a child who's younger, who isn't quite there yet, supporting you guys, because parents also feel poor acceptance, and they also feel isolation too. It's very real. Another area there that kind of on the mental health aspect that I found super duper helpful is neurofeedback, or neurofeedback, like therapy, doing that. I have a therapist I use here in Steamboat that is just amazing. And we've seen what I do get just taken to the next level, as far as just having some really great breakthroughs in that child's development when we start implementing neurofeedback, and vice versa. We see improvement in neurofeedback when nutritional and naturopathic medicine gets implemented.
Amazing. Just even, it really kind of, I feel like comes down to just addressing all aspects of the individual.
Truly.
Yeah.
And every kid and every person that identifies with ASD, the therapies are all over the board. It's not a one size fits all, right? Unfortunately. Unfortunately, that's true. And then the other part, the next aspect was talking about the physical medicine aspect. Craniosacral is fantastic for the nervous system. So is chiropractic care. Those are also can be very helpful. Sometimes can be triggering. So there again, that nervous system, it's a very, very sensitive system for those that identify with ASD. So, it's got to be a stepwise approach for them.
Yes, for sure. How about testing? What things do you want to look for in testing?
Yeah, so testing, a great question. Man, if I could run all things in the world, I would. Sometimes I don't. It just depends on the family and what we're addressing and what their needs are at that time, short-term goals and long-term goals. But, routinely I test cholesterol, lipid levels, iron and ferritin. The thyroid is super, super important. And not just the TSH and T4 and T3, but all the aspects of the thyroid, right? Doing a full comprehensive panel. Glucose and insulin, super important. We were talking about blood sugar levels. And if we see it on paper, we know that we need to support that more if we see like abnormal glucose and insulin levels. Liver health, some other things that I highly recommend, but you won't probably find from your general practitioner that's testing are organic acids and looking at other vitamin statuses. Stool testing, huge. I mean, digestion is so pivotal. Talking about what we eat is great, but we also talking about how our body is actually taking what we eat, whether it takes it or it doesn't, wow. Because if our digestion isn't on track, then what we eat is only going to go so far. Testing the methylation, we talked about that. Glyphosate, I want to put a little plug in for it because it's a huge toxicant. It's in Roundup. It's actually surprisingly a lot of places. And I find that is a huge, huge trigger for neuroinflammation and a huge area to address, as well as some other environmental ones. But that's one of the biggest ones that I really like to look at for children. Heavy metals, other environmental pollutants, there's some toxins. So like mold and yeast are super important. Yeast especially. I really, really find that yeast can be a little bit more common in this population. So looking at it, making sure we don't have a yeast overgrowth, because that can cause worsening of symptoms and can lower that threshold for our triggers. Food allergy and sensitivity testing on occasion. I do like to look at zinc support, zinc levels, and sometimes celiac testing if necessary. But that's just another area that I had one patient where that happened to be just a really big game changer for their health.
Yep. Yeah. And going back to the glyphosate, that's something that I even started getting into as well. And it was just so surprising at even patients who've, really tried to avoid Roundup and glyphosate and eating organic, it builds up in the body over time. And it's amazing at how it just also seeps into our food sources. So even if you're avoiding it, it still very well can be there.
Right. And the other thing is they say your body is supposed to clear it really well. They say that. But at the same time, we've got cancer that is connected to glyphosate. And it's like, well, if it doesn't accumulate, then why are we seeing more and more cases of this? And also when I've tested it on a few patients, actually a good number of them, and when I support the body in eliminating that glyphosate, of course, we're doing a lot of other therapies. I find that is a huge trigger. I mean, huge trigger. And when that goes down after retesting, we're like, well, it could be it. But I do think it's a huge problem.
Yeah, definitely. So bottom line, what are some of your parting thoughts for us?
Kind of bottom line is like we said, there's usually no curing autism spectrum disorder, but there are so many options and therapies available to investigate and implement to help reduce the severity over time. And hopefully, especially with children, getting that early investigation and intervention are key so that that child can grow and relate to their community and their environment in such a positive way to help reduce that feeling of isolation and rejection. Because truly, people on the spectrum are on another level. They just have more neurodiversity than others, and that's a beautiful thing. Should be celebrated.
It is a beautiful thing. I love how you put it.
Yeah.
Well, thank you so much for coming out again, Dr. Meg. We really appreciate you. And if anyone is interested in working with Dr. Meg, I'll have a direct link where you can find more about her. For those listening, you can find it on nawellnessglobal.com/thrivekids. So everyone have a wonderful weekend, and thank you so much for coming out.
Thank you. Thank you, Dr. Jenny. Glad to be here.
Bye.
Take care, everybody.